Hi, I was analyzing the numbers today and I realized that the when is already here. So we have formulated a 20-point corona prevention program. I had the opportunity of working with world-renowned virologist and former chief of Indian Council of Medical Research, Professor Dr. Jacob John. And the both of us have formulated this 20-point program. 1. Plan to create an isolation room in your house. 2. Get medications for symptoms of common flu. 3. Make it a habit to wash hands for at least 30 seconds whenever you come back into your house or at any point of time if you touch anything suspicious in public places. Sanitizers or alcohol-based solutions have to be rubbed on both surfaces of your hand and in the interdigital spaces for 20 seconds. Keep a handkerchief with you at all times. Use one handkerchief a day and it has to be washed every day. Now, the most important point here is once you use the handkerchief to sneeze or cough, do not use the same handkerchief to wipe dry your hands after you eat or after you wash them. Sterilize your phones. Use a fiber cloth with soap water and clean all the crevices and your phone's screen, because you take your phone everywhere, even to the toilet, and everybody touches it. Teach your children the one-arm distance, like in school. As long as you're at one-arm distance, the possibility of infection is quite limited. If you are a diabetic, this is a time for you to monitor strict diabetic control. When your sugars are at optimum levels, viruses find it hard to enter. Bathe every time you get home, and after that come and meet your family. It might be a great idea, to limit contact between grandparents who could be susceptible to the serious form of the virus and children. Be consistent in your schedule so that it is easier to do contact tracing afterwards. If you contract a cough or if you're sick, please use a mask. If you're somebody who's at high risk and you are going to public places where you do not know how many people will be there, you can use a mask even there. Please buy non-touch infrared thermometers in order to monitor if anybody has fever or cough in your house. Be aware of your surroundings at all times and stay away from anyone who appears to have a respiratory infection. Please call your physician or text him in advance to ask if it is okay for you to text him or call him for online on-phone advices. If he says no, then find an alternate physician who can help you that way. The groups who are at high risk to get the serious form of infection are anyone above 60, those who have a coexisting disease, hypertension, diabetes, uncontrolled diabetes to be exact, anybody with open wounds in the body, and those who have cancer. Basically, anybody who's not as strong as the average population. If you are sick, remember, it is a flu-like virus. So your body knows how to fight it, and your doctors have been treating patients successfully. So the only way you can help is do not panic. Just isolate yourself and let your body heal itself, and let the doctors work on you and treat you. Pray from home. God still listens. Thank you for listening. Information is the best vaccine against the COVID-19 SARS-2 CoV virus.